Nurses are the difference makers. Without the nurses, our patient care changes.
To be able to find that positive and remind people why we do what we do is phenomenal, and especially when it can come from something outside of just our four walls.
Congratulations! This is super fun. I want to do this every day.
My name is Jen Tran. I've been a nurse for 20 years. I started in the medical ICU, and now I'm a forensic nurse examiner. I think one of the most memorable patients for me is the first patient that was a human trafficking survivor. Usually in nursing, you're so used to touching people and being warm and friendly, whereas maybe that's not the place for that sometimes. I mean, I think they want it, but you just got to do it the right way so that you don't make them uncomfortable. You just don't know what you don't know until you encounter that patient.
We become that patient's temporary family. We become their advocate. We're the ones who have their back. We're the ones who, tell the doctors, this needs to be done. We need to do this, because we do develop a really cool relationship with every single patient.
Honestly, it's just an honor to receive that award. There are so many great nurses across so many different health systems. I feel like every nurse I've ever met deserves an award.
I was very overwhelmed when I received this award, but it made me think about my lifelong career in nursing and where it's taken me. I've always loved the nursing field, but I've always loved teaching. And so now with this job, being a nurse and teaching at the Health Academy these last 9 years, I'm getting the best of both worlds.
They're the unsung heroes. They are the ones who, over the course of the last several years, have had to deal with a lot, and they need as much support and recognition as possible. They don't ask for it. That's not what they're here for, but they certainly deserve it.
The Omaha World-Herald would like to present to you the Heart of Healthcare Nurses Award. Congratulations.
Thank you.
Yeah.
The reward that a person does get from that direct relationship with a patient is a sense of making a difference. That's what makes it worth it.
There was a patient that showed up recently. She's pregnant. She's homeless. Has a lot of mental health issues. I just sat there and listened to her, and I feel like she trusted me because she keeps coming back. You never know what people are going through, so just be nice to them.
The heart of nursing to me really is compassion. Nurses go into the profession to serve. Nurses are with patients from before they're even born all the way to the end of life. That really says a lot.
So the heart of nursing to me is helping them where they need help, or helping your coworkers or your teammates. And all of that is what keeps our patients safe and what advocates for them.
But the best thing about being a nurse is pretty much every day you go home feeling like you helped someone, or that someone maybe was a little bit better off than when their day started. And that's selfishly, it's very satisfying for me as a nurse, as it is hopefully for the patients that we take care of.
The most challenging patient that I had was an emergency room patient that was homeless and had been homeless for years. I worked with him probably up to 20 times before I got community help for him. He now is connected with his family. He has a job. And this has probably been about 10 years ago that we did that, and he's still doing well.
It means a lot to me. It means that people see the work that we as nurses do and how it affects people's lives and changes them.
Becoming a nurse is something you do because you're driven to. You don't do it for financial reasons. You don't do it because it's a job. You do it because you have a passion. And when you are taking care of other people, it's hard, but it's also probably the most rewarding thing that I've ever personally had the opportunity to do. And I see that in my bedside nurses every day. And that's the heart. That's what it's all about.
It takes someone who really, truly cares about other people. You really do have to put your patients first. It takes a lot out of us as nurses, but if your heart is in it, it is the most rewarding job.